Yeah, thank you, Minister. I'm actually taking Deputy Lawless. So, Minister, we know that home care really enhances an experience of many of older people in the later stages of their lives. However, there seems to be many obstacles to providing it, and I know from speaking to families all across Carlow that they are being put through great hardship in applying for and being granted home care packages. Can you tell me the number of older persons on the waiting list for the home care support in the local health office area? Now, I know, Minister, my own area is CHO5, and I know Deputy Lawless was to be CHO7, so I understand if you have my figures today. Sorry, thank you, Cathaoirleach.
Thank you very much, Deputy, for the question, and I know it's an area you have raised on many occasions with me. The Government have prioritised improved access to home support services through an additional investment of €150 million for 2021 for these services, and this has been maintained under Budget 2022. Estimated data indicates that over 13.2 million home support hours have been provided between January and August of this year, and that's about 2 million more hours compared against August of 2020. The number of people assessed and waiting on funding have significantly reduced through 2020 and 2021. This has been as a result of validation of waiting lists and availability of funding. I have the CHO7 figures. There was 250 people waiting for funding approval at the end of August 2021. 21 were from Dublin South City, 98 from Dublin South West, 53 from Dublin West, and 78 were from Kildare West and Wicklow. So, as I said, there was 250 people waiting in that entire area, but at the end of June 2020, there was 1,332 people waiting. So there is a significant reduction. The HSE will continue to work towards increasing home support provision. However, there are difficulties with recruitment and retention of staff, with certain areas experiencing increased pressures. This can lead to delays between funding approval and delivery of home support hours. I suppose when I came into post last Kiongorla, there was over 7,200 people waiting for home care supports for approval of the funding for that. That has fallen by 88%, but now we have another challenge. And the other challenge is that now we have an issue in relation to recruitment of home care workers. So whereas I'm in a situation now where I have the budget to pay for it, we are having difficulty in recruiting the home care workers. So as a result, the Department is committed to establishing a strategic workforce advisory group with involvement of key stakeholders, and I'll talk more about that in a minute.
Thank you, and thank you, Minister. Again, I have to pay a compliment to yourself too for fighting hard in the budget to get 150 million for the home care packages. And you know, Minister, and we all know now, people are living longer. Please God, we are all living longer. And as part of the future going forward, you know, a lot of family want to keep their mother or father in their home, and that's so important that there is that choice there. And we can see now, Minister, and I see it myself, the issue seems to be recruiting, and that's the biggest issue, that we have the funding and yet we don't seem to have the staff. And I just wonder, in that case, what does that mean? Are we looking at putting it on a statutory basis? Because as in the programme for government, it is that there will be going on to a time frame for this on a statutory scheme. So maybe you can explain that to me, because Minister, I, like yourself and other TDs, the biggest issue we have is where families are ringing to get home care packages all the time and they just can't get them. And I think that has probably become one of the biggest issues I think that will face any minister going forward, is trying to get staff and trying to make sure that the families that want to keep their parents at home are able to keep them there.
Okay, so the whole premise, thank you again, Deputy, the whole premise of Sláinte Care is the right care at the right time, as close to home as possible. And all I ever want to do is to listen to the voice and choice of older people and make sure that we can support them with the correct wraparound supports at home. As I've said, we're spending 666 million on home care every year. That's the budget. And that was an increase of 150 million this year. And as to have the budget and now to be short of the carers is very, very disappointing, I suppose, in one sense. So as I said, we're putting in place the Strategic Workforce Advisory Group with involvements of key stakeholders, including representatives from the sector. So I've met with HCCI recently, involvement from education, because you know they all come in at a level 5 FETAC, and obviously with the government. The group will provide a forum for practical action and collaboration, but we need to address things such as recruitment, retention and pay and conditions, skill development and sustainability employment into the future, and I want to see that first meeting happening as soon as possible.
Thank you. And Minister, again, recruitment here is going to be absolutely crucial. But can I also ask you, because I know also you've been working on this, what extra supports are being there in relation to home care packages for those with dementia? Because I know, Minister, I have spoken to you several times about dementia. Will we be seeing more funding for that? And what supports will be there for them? I think that's so important because as you said, Minister, the budget has just gone there now, and I know how hard you fought. But I can only just say, and I know it's so hard on people that are ringing my office and trying to contact community nurses and trying to contact the HSE, crying for extra supports at home. I would only ask that we do look at recruitment, we do look at the funding, and we do make sure that we can recruit, Minister, as soon as possible. I know that's out of your hands, as you said, but getting the staff when you have the money is going to be crucial for families now. Thank you.
Just before the Minister.
Yesterday I travelled to Kerry to open the 30th Memory Technology Room for people living with dementia, and I have to see, this was the first purpose-built room in Ireland. We have 29 others, but it's fantastic to see money so hard fought for in the budget being delivered on the ground, and it makes such a difference. So last year in the budget I secured 250,000 ring-fence hours for home care specifically for dementia. They were gone by July of this year, which is unbelievable. That'll just tell you the demand that's out there for home care. So this year in the budget, working with Minister Donnelly, I was able to secure 11% of the 5 million extra hours, which is over 550,000 hours for next year, specifically for dementia, and also another 7.3 million to roll out different dementia-specific supports to help people live at home. We want people to age well at home, and that's our focus. Gaurav Mahagut.